We're back with Dr. Fatunde. Dr. Fatunde, in orthodontic, I'm sure, well, I'm not sure, but I assume that there have been a lots of technical advances, just like in computers and in just about everything else. Tell us about how braces have evolved, and you don't necessarily need to go back to 200 years or how it was done or wasn't done, but at least in the last 20-some years, what is on the market out there? What are the 2 or 3 major ways of doing the same work, straightening out teeth?
Well, there's certainly been quite an evolution in the world of orthodontics. When I started in orthodontic school, at that time we had to put a band around every tooth. But gone are the days of metal
By
mouth.
band, you mean one of those metal wires?
Yeah, one of those metal bands had to go around each tooth, both the teeth in the front and the teeth in the back of the mouth. But these days now we have metal braces, and many of them are so much more smaller than what they used to be, and that makes them a lot more comfortable than what they used to be. So you have metal braces, and it could be the traditional silver-looking metal. We also have some gold-looking variants of that. Then there is what is referred to popularly as the clear braces. It's simply braces that has simulated the color of the tooth. It's so much closer to the tooth color, and that makes it a little bit less noticeable. You still know you have braces on, but it's not as noticeable. And this is very attractive to a number of adults. Then we do have the clear aligners, and we're able to do a number of movements with clear aligners. Maybe not in really severe cases, but what many adults sometimes are looking for is to move certain group of teeth, not necessarily all of it. Then we have what is now called the invisible braces. Invisible in the sense that it comes in on the inside of the teeth, not on the outside. And a number of adults are opting for this. Another name that is referred to is lingual braces. So there are a number of aesthetic alternatives, I call them. That is, they're not as noticeable, and a number of adults in professional life want to straighten the teeth, but they don't necessarily want to wear the braces on the outside. So we find a number of adults getting interested in the lingual braces, as well as the clear aligners when movement is of a limited nature.
I got it. Wonderful, I see. So let's summarize a little bit. There's the normal, and please interrupt me and kind of like help me along here. There's the normal braces, which are the metal braces. They, however, are much more comfortable than they used to be, much smaller, but still they're the metal type of braces.
Right.
Then, and they do the job. It doesn't more or less matter how bad the teeth are crooked. That's kind of the most or very robust form of fixing it. It fixes everything, right? If it is fixable at all via orthodontic.
Yes, it's expected to. And if I may add, even the metal braces, like I said, they come in the traditional silver, you have the gold plated, but also, and through all those, we have the wires going through, and the wires are held in by what we call ligatures, which could be elastic in nature or metal. But we also have the self-ligating metal braces, and those do not need either the wire or the elastic ligature because it comes with a clip that self-locks the wire in. So as part of the metal braces, we have the self-ligating, and the clear braces or the braces that's closer to tooth color, some of them also come in the self-ligating as well.
Got it. Now, is any one of those, you see these days some of the kids, they have braces and they put their school flag or their favorite football team flag on it, or a little heart at Valentine's. Is any one of those braces doing that, or is that just a cosmetic addition to anything, or is that a different type of brace yet?
Well, it's not really different. It's you could say it's targeted to the youth. A lot of it is metal based, but it can be customized, like you said, with their football colors or with their logo, with the school logo, with whatever they want. So that's another variant that's just targeted to that specific market who, you know, they are proud to show off their school colors, proud to show off their logos. Some of the kids actually will design what they want and will send it to the lab, and the lab will customize it. Beautiful. You know, for that particular patient.
Mm-hmm. Beautiful. But so we're still dealing with the metal or the clear braces. Then we have the braces which go behind the teeth only. Are those ones also for rather big cases or relatively small cases? Let's say 2-3 teeth in front, which an adult wants to straighten out, or what are those braces meant for?
They can do both. We have those that can just fix a group of teeth or a few teeth, and we have those that can address the entire mouth, that will go on the inside of the upper and the lower as well.
And when those braces are on the inside, do they not bother the speech, the tongue kind of, I mean, if I have something small stuck inside, it bothers me quite a bit. So what about if you have a brace, a wire there?
Well, in terms of whether it will hurt you or not, no, they really won't hurt you. But yes, there is a period of adjustment. Inside the mouth, we have a landlord there, and that's the tongue. Therefore, anything that comes on the inside of the teeth, expect that the tongue is going to go around checking it out. Who is this newcomer here, and why is it in my territory? But after a while, the tongue learns, okay, it's here to stay, and then it adjusts. So there's an initial period of adjustment. Same on the braces that's on the outside. The cheeks, for a while, are busy moving around, trying to check out, okay, where did this newcomer come from? But after a while, they settle. You may expect a little more time to adjust for the tongue. The tongue is a very powerful muscular organ, and so it doesn't give up easily in terms of accepting a newcomer in its territory, but the tongue learns to adapt. It's very adaptable as well.
Got it. And then the fourth one, or the other one, would be the, so to say, invisible braces. There's a kind of like a plastic type of tray, almost like a mouth guard, well known under the name Invisalign. But Invisalign is really just a brand of company which makes it, happens to be the most famous brand, and probably very good, but not necessarily the only brand achieving that thing. And is that correct?
That's correct. Invisalign is probably the most known brand. It's one of the first few ones that came on, but there are other companies. There is Clear Correct that does the same thing. And the way that the clear aligners work is the whole treatment is taken from beginning to the end, is broken down into little pieces. And then each aligner is made for that. So it's kind of sequential treatment. Aligner 1 will take the teeth only from point A to point B. And then aligner 2 comes on and starts from point B and takes the teeth to point C. And then aligner 3 comes on. So it's such that you have to start with aligner 1 and go in sequence. And if you skip a sequence, you've got to go back and make sure that whatever you lost has to be repeated. Otherwise, the next aligner cannot pick up from that. So you can refer to it as sequential treatment. And there is a lot of responsibility on the patient who wears it, because if the patient does not wear those aligners as instructed, then the teeth cannot move. So it is very important that a patient who is going to be treated with clear aligners understands that compliance on the part of the patient is really the key to treatment. In every type of orthodontic treatment, compliance is a good part of the treatment. It doesn't matter whether it's metal braces, inside or outside. Orthodontics is one specialty in dentistry where the patient and the doctor are actually partners. I tell my patients that all the time. They have responsibilities which if they don't do, it doesn't matter how well I can do my job, we're getting nowhere. Just as I have to do my part, the patient also must be compliant in keeping the instructions and in doing their part.
Right. And that is unfortunately something all of us, and I'm of course completely included in that very heavy, in many areas of life keep forgetting. You know, technology and other people come up with so good thing and we become lazy, be it in losing weight. We think we can take a pill or, drink a juice and we automatically lose weight without change of lifestyle. And in so many other areas, doing well in business, it wouldn't matter, hire a consultant, do this, read a book, and it's like, oh, it's all out there. No, we do need to participate. And the funny thing really is, I think, and this has nothing to do with all this, it's just my personal feeling that if we do participate, that's actually how we have fun in life. And I do think to a certain degree that's why there is more people thinking they need a depression tablet, an antidepressant or something. They just don't have enough to do. Do you understand? You just participate in life, and of course it will be difficult. And that's just what it is. So anyway, doctors, thank you very much. This video was already a little longer than we expected, and we're going to go into much more details about each one of those type of braces. But I appreciate your informative, candid interview here.